Welcome back to another episode here on the Heart Hustle. Let's start this over. Welcome back to another episode here on the Heart Hustle podcast. I'm Ephraim, and this is Catherine. Miss Catherine, how are you doing today?
Doing great. Thanks for having me.
Good. I'm over here flubbing up my words, and we just getting started. And luckily, it wasn't on camera, but
I almost just said it's Monday, and it's not. So I think we're on a similar page.
Well, we were just talking about how we can't believe July is almost over. That the time has really passed. Let's just kind of start there. We're about to be 8 months into the year. What are some of the wins that you guys been able to see this year?
Ooh, that is a good question. There have been a lot of wins. I think from a business perspective, and I'm the director of development and communications for a community health center in Denver, and there's a lot of things going on outside of our control that have kind of put roadblocks in our way. But through that, I feel like our leadership has been really strategic and just stayed by our community and not wavered from that. And with that commitment, we've grown our patient population by over 1,000 people. We're expecting to serve 9,000 people this year. And last year we served 8,000 people. So that's been a huge deal. We've been able to expand my development team to kind of fill some funding gaps that have been caused by some of those external barriers. So we're still chugging along, which has been, I think, a feat in itself.
Okay, and that's the big W's, but then you got another W that you're working on, right? Which is this October event. We just talked about raising funds. Like, what does that look like for those that may be interested in something that you guys got coming?
Yeah, so October 1st, we have our Legacy of Health Gala. It's our annual gala. It's at the Sewell Ballroom at the DCPA. If anyone in Denver or outside wants to join, it's a really amazing event that just highlights our patients, our staff's commitment to our community, and really the fact that we can't do this without our own community. So bringing folks into the room to just be together in unity. And fundraising, as we talked about earlier, it's all about relationship building. So it's, for me, a really fun event because I get to walk into a room of 400 of my friends and acquaintances. It's a really special event.
It's crazy. I think when we were talking about our events, mine's October 2nd, and it's called Eagle Legacy Night.
Oh my God.
So that is very similar. We might have to just kind of partner up and bounce ideas off each other at this point because we're really coming down to the wire. I appreciate it. How did you get into this space? Like, this is a very purpose space, a very passion space that you're in. I always say it's never about the money. Clearly, it's about helping your community. What makes you get into the space of giving back?
Yeah, I feel like this is a pretty classic answer, but I feel like it all started with my parents and my family. I was raised by a family of kind of servant leaders, of teachers and nurses, and folks who just have lived to give back. And within that, I also had a grandfather who had inclusion body myositis. It's a disease. It's pretty similar to ALS, but it's way slower progressing. So for my entire childhood, I watched my grandfather try to navigate a healthcare system that's really not built for anyone to succeed. So through that, and then having just that framework of giving back to my community through my family, I ended up going to school and getting my bachelor's in rehabilitation psychology, which is a degree that basically helps folks with disabilities or new injuries get back into the workforce and find their purpose. Through that, I found a love for social work, got my master's in social work, and just dove in from there. I worked in anti-carceral work. I worked in a prison for about a year, and that burnt me out really badly. The system is it's so big and it's so difficult to try to push against. So I took a step back, started grant writing, and through that got into fundraising. So here I am.
Grant writing, fundraising, those are not easy things to do.
No.
But they're fun. They're definitely fun when the money's flowing in and you're getting these opportunities.
The highs are high.
When you talk about healthcare just kind of being difficult to navigate, what are some of the things that you've been able to learn along the way that makes it that difficult?
It's a great question. I mean, something that we're seeing right now, and it's been kind of a theme across the board, is changes to Medicaid eligibility and just the rules within it, that makes it extremely difficult to navigate healthcare when you don't have insurance from other routes. And actually, even folks that work full-time jobs end up needing to use Medicaid. So, right now, for example, we have about 100,000 people in Colorado that are anticipating to lose Medicaid because of eligibility changes in 2027. So that means finding a new primary care for your kids. That means finding a new pharmacy to get your medications to make sure that your chronic disease is managed. That impacts your ability to get ramps and walkers and anything that you need for your mobility. So it's a really big deal, and it just kind of fuels my fire to work for a community health center where we don't turn anyone away. Everyone is welcome. Everyone is given care with dignity and respect, and really high quality care, regardless of insurance or ability to pay.
Love it. And how long have you been with this organization?
I've been here for 3 years.
Okay. What brought you to it? What made you say yes when they call when because that's always a thing, right? We could apply for any job, but there's a job they got the yes.
Yeah. I'd been working as a grant writer fully remotely, and I just felt really disconnected from my community. And I found this health center. It's really close to my house. So not only did I feel like I was within the Denver community, but really my own community, working with my neighbors. A grant writing role came up, and it was in a really exciting time in the organization. We had just moved into a whole new building that had expanded from 6,000 square feet to 24,000 square feet. So that we were going through a ton of growth, and it just felt like an amazing opportunity to jump in and get involved. And I could not turn it down, and I'm glad I didn't.
Love it. And you talked about remote work. What is your thoughts on remote work? Like, are you loving it? Are you in office at times? Because someone nowadays we just do so much remote work. It's almost normal, but it's sometimes like, do I miss people? Do I want to have that?
I was bad at remote work. I'll tell you that. I just at the time my office was in the basement. It just felt really isolated. Now I work 2 days in the office, and I love that personally. Some people can crush remote work. I need some interaction for my social battery. I will say though, I actually get more work done at home because I'm able to just walk in and not
socializing.
Yeah, which is all me. My coworkers are like, "All right, we're ready to work. Can you leave us alone, please?"
That's much fun. When it comes to grant writer, what are some of the things for those that may not know anything about grant writing? What are the things that you do as a grant writer? Because you're not just sitting here writing all day.
Yeah. It's changed a lot in the last few years. Previously, you could do a lot more of just sitting behind the computer and writing and submitting, and kind of hoping for the best. Now, the grant landscape is so competitive because of changes in federal and state funding. So you really have to do a lot of networking, a lot of groundwork on the front end to build relationships with funders, make sure that your priorities and their priorities are aligned. So it's a lot of meetings ahead of time to make sure everyone's on the same page, and then building the grant from there.
And is it that we have to raise funds for these community centers because of what's happening at the government level? So we just have to fill in the gap, or is this something that you guys always do, just being able to raise those funds for the organization?
Yeah, that's a good. I mean, so some nonprofits would always need to be doing this at a really high level because there aren't other sources of revenue. For us, we have patient revenue because we're a health center, so we get paid by Medicaid or private insurance. But we serve the highest percentage of uninsured patients in the state. So over 50% of our patient population is uninsured, which means we have about 50% of our budget that we need to fill from a fundraising perspective. So that's through grants, that's through individual donors, through corporate sponsors. So we really could not do this work without our community partners.
And what do these funds go towards?
They go directly to patient care. So that's making sure that we have the medical supplies we need, making sure that we have the medical providers that we need. Medical providers are so expensive because they're in high demand. So that's a really big cost that those funds go to. But through that, we have some of the highest levels of care in the state. So we're really lucky to have the folks that we do and want to keep them around.
Is it still, I know during the COVID, I don't know what it is now, that there was just kind of like the lack of nurses, the lack of
Mm.
doctors. Is it still the
Mm-hmm.
same? Is it getting better over time? I know that we've kind of got into the AI space. Now
Yeah.
people can do more of what they love, less of that repetitive work. Are we
Yeah.
seeing a change in this industry?
I can't speak for hospitals, which I think is where they felt it the most in terms of nurses and doctors and burnout. Though for us, there is still really high need for workforce development and creating those workforce pipelines to make sure that we don't have a shortage. For us in particular, all of our patient facing staff speaks English and Spanish. So that creates a unique challenge in hiring as well, because not only are there not enough, dental technicians, pharmacy technicians, medical assistants, in general, there also aren't enough folks that are Spanish speaking and working in those roles. So we're working really hard with the state and a few other community partners to build that pipeline, because long answer long, it is still an issue. And I will say, I think people talk a lot about AI and, that impacting things, but there are still a lot of people that want to be working in community. And we're seeing that through the success of our workforce pipeline programs.
I love it. How big is the organization? Do you know how many people work within the organization?
We just hit 100, which is a huge deal. When I started 3 years ago, we were at about 60, so we've grown a ton in the last 3 years.
Yeah.
Yeah,
That's
yeah,
really good. What
yeah,
helps you guys grow? Is it just getting the word out more, meeting people where they're at? You talked about making sure that there's English and Spanish speaking individuals. Like, what gets you guys growing?
from a employee, from our
Employee and even patient. Because you mentioned what, 1,000
yeah,
plus,
yeah,
right? What's
yeah, yeah. Um, from an employee perspective, what helps us grow is our patient population, honestly. It's when we can grow our patient population, that helps us be able to grow our staff as well, to then keep growing our patient population, because that just increases our funds to be able to do it. From a patient perspective, a lot of it has to do with just community need. Um, there are, even with outside of these Medicaid changes that are happening in 2027, we're seeing folks who are declining insurance in general because it's just too private insurance because it's too expensive. And then we're the safety net that people look to. So I think if the reason, unfortunately, that our patient population is increasing so quickly is because of community need. But that being said, I feel really lucky that we can grow to meet that.
But and how do we get the word out in the communities? Is it that we are, changing the way that we communicate? I think that's a huge thing, right? Just
Yeah.
communication in general. Whether in the center or out the center. What does that look like nowadays when we're communicating and meeting people where they're at?
Yeah. I mean, it's a challenge. We've shifted a lot more towards Google ads and things that are online. Mostly because we can track it and make sure that we're,
Hmm.
hitting the right people. But I think, um, for example, we have an HIV clinic and we were able to put out Google advertising that was specific to that. And that was really successful and brought folks in. But a lot of it's also through community partnerships. And, when we talk about meeting people where they're at, we work with food banks and schools and places that folks are already going, and then they can refer their clients or their students, their families to us. That's really where a lot of our growth happens. But outside of that, I mean, we're using social media channels. We have all of our emails going. I mean, the drill. It's just
Yeah,
how
yeah.
many channels can we get through with two staff? you know
Yeah. That's what I'm trying to focus on now with social. When we talk about this fundraiser, is like, how do we tap into more social and more
yeah,
storytelling, right? Because we
yeah.
we also want that different audience. It is a lot of work, Catherine, and I say that because it truly is. I mean, I can imagine you go home sometimes, you're thinking about work, but what does Catherine do to turn it off?
Does it turn off? No.
I say the same thing. Like, I don't know that I do.
Yeah. What do I do? I mean, I live in Colorado, so there's the mountains, and I mean, literally everyone in Denver is gone on the weekends. Everyone's in the mountains, especially right now. It's been so hot. So hiking, camping, skiing, it feels like a basic Colorado answer, but that is definitely where a lot of my energy
That's
lies.
good. I
Yeah.
mean, I'll tell you what, I went to Arizona
Yeah.
and they do not have pretty mountains, first of all. Someone told me I've seen mountains and I'm like, these mountains are not it. It's like, you got to go to Colorado. That's the best mountains ever. So that you said that is funny. But it was hot as hell in Arizona. Okay. It was 115 degrees.
Oh my
So
God.
no one wanted to hike. Actually,
Yeah.
on my way there, I seen the ambulance and the police out there. And, the police, when someone asks, a child asks, like, is everything okay? Yeah, somebody just got hurt.
Yeah.
20 minutes, because I was with my young one, so we didn't really go hiking. We just wanted to see the Red Rocks. And as we're walking back, we're actually seeing them carrying this body bag from the back of a pickup truck into the SUV.
No.
What it was is someone was hiking, got dehydrated, and didn't make it back down. And I'm sitting here like, holy crap. And supposedly it's just normal, right? Because how hot it is, people think they're going to go hiking, don't get hydrated.
Yeah.
But you're telling me that hiking Colorado is completely different. It's actually good weather to do it. Is that what you're telling me?
I mean, it's hot out here, but I'll say I've personally never seen that, though I'm sure things happen. Yeah, stay hydrated. It's hot out here. And in Colorado, we're at elevation, so it makes it even hotter. I was talking to one of my coworkers and she was in the mountains and it was 70 degrees, something like that. It's like, oh my God, that sounds amazing. She's like, yeah, but it felt like it was 90 because we were at, 11,000 feet. So you're like over a mile into the sky. So yeah, put your sunscreen on, drink some water if you're coming out here.
For sure. Were you born and raised in Colorado?
I wasn't. I was born outside of DC in Arlington, Virginia. But then I moved to Wisconsin for school. And then I moved to Thailand for a year after that. And then moved to Denver. So, classic route.
I mean, that all random, to be quite frank. But Thailand, how did you end up there?
I studied abroad in Singapore, which is like such an obnoxious answer. Study abroad changed me. But while I was there, I met a bunch of people who taught English abroad. And my friends were all like, well, if nothing works out when we graduate, I guess we can do this. And I was like, if everything works out when I graduate, I'm going to be doing this. So I came home, bought a one-way flight to Thailand. My boyfriend, now husband, was like, I guess I'll also come with you if you're going. So he also got a flight and we lived there for a year, taught English. It was amazing. And then he grew up in Minnesota and had come out to Colorado, as a lot of Midwesterners do. It's a pipeline, I swear, from the Midwest to Colorado. So we moved here when we came back.
Wow. That's so cool. What do you think that Thailand just journey taught you? I can imagine there's always that learning lesson in everything that we do. What are you learning from that experience?
Flexibility, for sure. Things do not run on time and I personally love that, but not everyone does. But it's just a lot of, we always joke that if you didn't see a car reversing on the highway, you hadn't spent a day in Chiang Mai. Like, things are just a lot more chaotic and beautiful. And I loved that. So I feel like that helps with nonprofit work because it is chaos all the time and you're kind of just, figuring it out day by day.
I love it. I love that you just kind of love that the challenge of life per se. Like, so many people want comfortability and it's like, nah, give me the curveballs. Nonprofits give you curveballs every day. Would you do it again? Would you go back?
Oh my God, I would go back in 2 seconds. I wish I could be there right now. I would. Yeah. A lot of my friends stayed there and still live there. So they're still living the dream. I mean, we got really lucky. We came back right before COVID. So timing wise, it worked out perfectly. But yeah, if you see me on social media on the beaches in Thailand, you'll know that
You made it back. No, one place that I loved, and I just feel that people should definitely travel outside of our country.
Yeah.
There's so much beauty in it. And I think sometimes we are giving the wrong side of a lot, right? So I went to South Africa and people were scared for me. And I was excited to go. And to this day, I can't wait to go back. Like, I tell my wife and the kids, we got to go. Like, I would move there too, and it's just, I just love the beauty of it. I love that it was, I don't know, it just felt different. And they had to me so far, the beautiful mountains. I haven't seen Colorado, so I can't compare it yet, but I love the mountains as well.
Were you in Cape Town?
I was in Cape Town, yeah.
Yeah, those mountains are epic. That's really fun.
We woke up one morning. It was like 5 o'clock. I mean, it's like I was at work/vacation, so I was there for 3 weeks for work, and every day it was just like I was on vacation because we were teaching at 4 p.m. to 12 in the morning. So during the morning time, oh my God, the morning time we'll go to breakfast and I have an even number situation, so I can't drink odd numbers. So we were drinking mimosas early in the morning. Yeah. 3? All right, yeah, I got to get the fourth one. I got to get the fourth one. I tell you, the best mimosas I've tried because it was just fresh orange juice. I remember coming on my way back, stopping at in DC and asking for mimosa at the airport, and I said, "What is this trash?" Like, but I truly did love South Africa, and from those moments of seeing how people just treat us, also as Americans, they care and they have almost nothing, and the way that they still care and love and the passion they have for learning. I just appreciated that, and I would love to come back. I would love to go back at some point, probably similar to why you would want to go back to Thailand. You just felt one within a whole new world, right? Like, at any moment, did you feel like nervous or scared or maybe you felt that? Or
we'll say that I am cursed with way too much self-confidence. So I went in just ready to hit the ground running, ready to, do whatever I was going to do. But I would say that with that confidence comes situations that then I was like, oh, I'm going to end up being like dumb American tourists, like there was a time where my family was visiting and we were going to go on a snorkel trip. It was going to be amazing. And we turned a corner and we were on this tiny boat. I mean, I can't believe it was afloat in good weather. It was so small. And we turned a corner and this huge storm had rolled in. So we were all getting battered by the storm. The guy, running the boat or, captaining the boat I was talking to him in Thai and just kind of being like, "Are you okay?" And he was like, "No, things are not okay." We all had scuba masks or snorkels outside to be able to breathe. It was nuts. So in that scenario, I was nervous, I'll say, but that was kind of self-inflicted. We could have easily just not gone into the storm.
Yeah. So I'll tell you another funny story. I felt great the whole time, but they did tell me, be mindful of the pocket picketers. And I'm like, okay, like, shouldn't be a problem. And we were all good. And then one night I remember going out, it was like 6 instructors. So we were all hanging out. It was 2 o'clock in the morning. You can imagine what we were doing at 2, 3 o'clock in the morning, heading back home. And everything was walking distance. And I remember this guy, homeless guy, just kind of like trying to walk us. I'm like, nah, bro, we got it. And I remember him getting so close, but they're so good that I didn't realize this. So I literally just took a picture and send it to my coworkers. And I told you about Catherine, the one I work with. So it was her and Brendan. I sent it to them. And 15 minutes later, my phone got stolen. The picture I said, beware of pocket picketers. And 15 minutes later, my phone gets stolen. And I was just so mad, Catherine. I was walking up and down trying to get this phone. I was like, why didn't they take the work phone? They took my personal phone. I should have left with my work phone.
Like, I'll switch with you.
But that moment, while I was a little upset, it was replaceable. I still had the blast. I still had the time of my life, I would say. And the people were really great. Catherine, I really want to know, what are the values that Catherine lives by?
What are the values that I live by? That's a great question. I would say, this is going to sound corny, but there was this book that my mom would always read to me growing up. I'm totally blanking on the title right now, but it was something about the lupine lady. And it was this woman who had this goal where everywhere she went, she just wanted to leave it more beautiful than when she found it. So it was like, she wanted to leave the world more beautiful. She wanted to live by the sea, and basically just make an impact wherever she was. And I will say that when I was younger, I took that to heart and I felt like I was going to change the world and, do something huge. And I think now, day to day, it is just about the one-to-one connections and just making things a little bit better, a little bit more comfortable, a little bit of a smaller barrier for the people that I'm interacting with day to day. I think my values just really lie in the value of people. I want to make sure that our community is safe and cared for, and especially at my work, that healthcare is a human right. It's not a convenience.
you're pretty much doing the work, as you mentioned. You're probably not living by the sea, but
Yeah, I still have that to work with one day.
yeah, you're close. You're definitely
Yeah.
close. Um, Getting into the nonprofit sector, for those that may think that there's no money in nonprofits, I think people would just have this idea of what a nonprofit is until you finally get there and realize, wow, this is a place I should have been in a long time ago. What is your thoughts on the nonprofit world? I guess you probably worked for a for-profit sector at some point. What was the differences as well?
My first thought was the difference was like, well, we had lunch provided every day at the corporate office, and now that's not the case. But I think from a nonprofit perspective, there's definitely, I think people nail it in some perspectives. There are not all the perks of, the super, super nice high rise office and a lot of the kind of comforts of working for a larger business. But on the flip side of it, I feel like what I do makes a difference, and I would take that every day over, the nice view out of my office window. I think that the I will never say there's not value in money, because I think that's super privileged. That, in the country that we live in, you need money to have a safe home and to have food and to have all these things. But I will say, once those things are checked off, I think that the rest of your life and like your purpose really needs to be filled with passion, and that can be found in the nonprofit sector. It can be found in other places as well. You can work it for a corporation and volunteer on the side. There's like the time, treasure, talent trope of, there's a lot of ways to be involved, but I think working 9 to 5, really frequently more than 9 to 5, in a space where everyone's there because they care, is amazing. I
Yeah.
love my coworkers, and I love the patients in the community that we work within. And I'll also say, as a side note to that, um, you mentioned earlier, it might have been before we started recording, that you need to run nonprofits like a business. And I think that in many ways is very true. We actually need more people that have corporate experience and more business experience to come over to the other side, because
Mhm.
there's so much value that can be brought from folks that have, you know, accounting experience, and people who are in sales and fundraising can have a lot of crossover. So if anyone's interested, come on
Yeah.
over.
Sales and fundraiser are really the same damn thing, if it
Mhm.
just disguised differently, I would say. But won't you
I'll
say they're
say
the same thing?
they're the same thing, but I'd be a terrible salesperson. I think I'm only a good fundraiser because I love what I do and I care about it so much. I'm sure you feel that way if you're a salesperson for a product, but I I have no problem sitting down with someone and talking about the organization I work for. Um, with because there's this thing, it's like teaching the people the joy of giving, that's what fundraising is. I think you're really inviting people into the mission, inviting people into that purpose, that sense of purpose that everyone's looking for. So yeah.
I always love me a good story, Catherine. So do you have a story of just an impact story that you are a part of, or that just resonates with you when you think about the organization that you work for, or just the ability to be a servant and give back?
Yeah. You touched on storytelling earlier. Storytelling is such a critical part of what we do. And there are so many. I think about we because we have primary care, behavioral health, dental, pharmacy, case management. We do a full array of things, and including it within that, we also do, you know, actual community health, where we have community health workers in at events. They go to over 100 events a year. And one of our community health workers, we use a promotora model. So one of our promotoras was out in this event. She's been with us for, 15 years. Everyone in the community knows her. And she said she showed up to an event and this woman ran over and gave her a huge hug and started crying. You saved my life. You saved my life. And she was kind of standing there like, what do you mean? How? I love to hear that, but what are you talking about? And it turns out that she had run this class that had, it was about detecting breast cancer. And the woman, because she'd gone to this class, found that she had breast cancer really early and was able to treat it, and just felt really lucky that she was able to have gotten that education. Um, we also have a story. This one always sticks with me, where we have a pharmacy, but it's called a 340B pharmacy, so that we are able to purchase our medication at cost and then provide it essentially at cost.
Love it.
So it makes them way less expensive. And we had a woman come in, she was in her 3rd trimester of her pregnancy, and she had asthma, and the regular pharmacy that she goes to, when she went to fill her prescription, it was going to be $500. So she couldn't fill it, was terrified to leave her house because she was scared that she would have an asthma attack and that it would hurt her baby. So she hadn't left her house in weeks, essentially had was suffering from depression and anxiety because of it. And she came to Tepeyac, and we were able to give her a prescription for an inhaler and fill it for $5. So the impact of just being able to access care when you need it, it's just life-changing, literally.
Yeah.
So, I mean, I could go on and on, but
that's why we do it, right? Those are the differences that you talk about in life. You got kids of your own, Catherine?
I don't. No, but my sister-in-law just had a baby, and it's our first nephew. So we now have a nephew.
Okay, not yet.
Not yet.
Whipping time. No rush. I got 2, and I'm thinking like, oh my God, what's happening? No, they're a blessing. They're a blessing.
Yeah.
But okay, I'll ask you that from a perspective of an aunt.
Yeah.
When your nephew, was it? Nephew grows up, what do you want him to remember about Catherine?
Oh my God, you're gonna make me cry. I'm thinking about my new baby Woody. That is a really, really hard question. I think that I would hope that he remembers that I am warm and loving, and that I was silly. Like, I think a lot about being an adult and just holding on to humor and making things silly, especially when things feel so heavy. And I would hope that he would remember that.
Yeah. Are you that person that turns everything into a joke?
Yes. I think, unfortunately for the people around me, yes.
Yeah, me too. I was the other day, sometimes I always feel like I just probably got on my period and I just start emotionally crying. And I was with my friend, and I'm like, I feel these tears. I'm talking to my best friend. I feel these tears coming in, and I just say something off the wall, and she just dies laughing. She's like, "Why do you do that? Like, here you are about to cry. You just say something stupid." And it's just, I don't know. It's just who I am.
Yeah.
So I love it. I do love that sense of humor. My kids now, I appreciate it. It's probably what's going to get them in trouble, is that they have this sense of humor and that they're so quick on their feet. But it is the funniest thing, and because that's who Dad is. Like, I can imagine they get it from Dad. But Catherine, it's truly been a blessing to talk to you and learn more about the organization. But I also like to hold people accountable. So I like to always ask, what is that goal for Catherine the next, let's say, 3 years? So if we have this conversation again, I could definitely come back to it and say, hey, Catherine, what happened to XYZ? What is that goal you have in mind?
Yeah. Oh my gosh, now I'm in a job interview. That's a great question. I think that in 3 years, I mean, so much can happen in 3 years. But when I think about my current position, we're in a phase of growth and change that's really positive, but we're kind of starting. This is such a boring answer, but we don't have our workflows together. We don't have our, role alignment totally set, and it's making it so that all of us are doing 15,000 things at all times, and that makes me really worried about my team. I don't want people to burn out, and so right now we're working really hard to make sure we have those kind of ducks in a row. So I'm hoping in 3 years I could look back and say, all right, we did it. We have our workflows. My team feels great. We've only been able to grow from here. And then personally, I think that I still have so much to learn. I'm really new in this role. And I take growth really seriously. So I'm currently doing a certificate in fundraising management. I hope that I will have finished it by then. And I hope that I'll have just become a stronger leader and mentor through that experience.
I love it. Well, Catherine, it was definitely been a pleasure. Thank you so much for talking about what you guys are doing in the community. Thank you for just being you. And you said you're just getting started, right? This is just the early days of it all. So I can imagine what it looks like as you continue to just chase that passion, continue to chase that purpose, continue to be a leader in the community. At some point, someone's running up to you 15 years later and say, thank you for saving my life. That's why we do it. We don't do it because it's a paycheck. We do it because we truly, without knowing, are watering seeds. We're planting seeds. We're making the difference. Kind of to the book that your mom has read you is, how do I leave this place better than I found it? I love it. I love it so much. My name is Ephraim. This is Catherine. If you guys are enjoying these conversations, please make sure that you guys do like, subscribe, and comment. I'll see you on the next one. Laters.